Hi, Dr. DuPéré here in Toronto. I want to talk to you today about one of my favorite procedure, upper lid surgery, blepharoplasty. Upper lid surgery is a very common procedure. It's one small procedure that gives a big benefit to patient. The scarred incision is so hard to see that it's also a very popular procedure for our males as well. So an upper lid surgery consists of removing excess of skin in the upper lid, but also excess of fat pads. Our eyeball is surrounded by cushions of fat, and they tend to herniate out as we get older. So the upper lid, you can see at your parents or people around you, they'll have a little puffiness in the inner corner and also in the upper part, central part of the upper lid. Those get removed. We remove the excessive skin and it alleviates that hooding that people get, and that also gives big benefits in rejuvenating and looking younger. So upper lids are relatively simple. They're often done under local anesthesia. I will offer a mild sedation if my patient want to take the little anxiety out of the equation. But overall, 1 hour procedure, simple. The recovery will have to do with a bit of swelling, a bit of bruising, stitches for 1 week. Usually within 2 weeks or so, patients are back at work. Now, lower lids are often combined with the upper lid. So when we do I call them the 4-lid blepharoplasty. The lower lid is a little bit more delicate structure, should be done carefully, patiently as well. I like to put my people to sleep when I do the lower lids. The lower lid has excessive skin, but also fat pads. The lower lid has 3 fat pads. And lower lids, when it heals, has a tendency to heal with a little retraction. So the surgeon has to do little maneuvers inside, which I call suspension techniques, to help the lid to stay in the correct position while the eye is healing. With a bit of swelling, with a bit of weight due to the swelling, it's important to suspend the lower lids. We call it cantopexy, and I do it on almost all our patients. Now, one more point on the lower lids. If the lower lid has no excessive skin, just fat pads, we can do the procedure from inside the conjunctiva, so there's no external scar. If there are fine wrinkles and fat pads, we can still do it from inside with laser resurfacing on the lower lids. But if there is a significant excess of skin, the incision is hard to see, hidden in one of the lower lid fold close to the eyelashes with a quick extension along the crow's feet. Eyelid surgery, again, is a very common procedure in our clinic, alone or along with facelifts. And it's done, I would say, equally between men and women. Thank you.